Doc, medical marijuana.
Yes. For medical marijuana, may dalawang component kasi doon. We have the CBD, cannabidiol, which is the beneficial part. And merong THC, merong harmful part.
Hindi naman contested yun eh.
Oo, hindi naman contested.
Ako, I believe in that too.
Oo. And there are also several reports that it can help seizure patients, mga videos, very dramatic, for stage 4 cancer. Actually, the studies are not yet out. We're still waiting for it, but when it comes out, we can decide. But I think for medical marijuana, I'm for it.
Yung beneficial part, is walang hallucinogenic
Yun,
effect?
wala yun.
Wala. Okay.
Oh, wala siyang high.
Hindi. Kasi laging may halo, it depends on the strain. If you plant it in this area of the Philippines, you will have this kind of strain.
Sa Baguio daw. Diba?
Saka hindi naman siya, it's not smoke, di ba? It's extracted.
I think one day it's gonna be a tablet.
Yeah.
And
sinasama lang siya sa
drug
medicine.
companies will use
It's not
it.
really weed that
Yeah,
they
but
smoke.
I have a friend kasi who tried it. Well, he shouldn't be
Yung
trying it.
yung cannabinoid.
With medical marijuana. Well, of course, he shouldn't be trying it. But he tried it now, and he got a high after a few hours. But I suppose it depends on the variant. No, it's not. It's an oil.
Yan talagang oil. Yeah, it's an oil. Well, the President Duterte supporting medical marijuana. He's already come out with it. Do you think the president's health, he needs it for his chronic pain? In case it's legalized, he can use it for his chronic pain. And even GMA has supported it. I mean, do you think the president's health is what do you think? Do you think the president's health should be a matter of public knowledge?
I think the president is very open. He tells everyone he has Berger's disease from smoking, he has a neck problem.
Doc, ano ba expect? I mean, maybe you could tell us. Burgers, give us the context. Is it serious? Is it something that we should be worried about?
Kasi sabi it could progress into cancer.
Kasi yes, he's open about.
He can finish his term and he can decide. But he will be in pain if you have that disease from smoking. And of course, yung mga problem mo with the neck.
Yung Barrett's esophagus.
Barrett's esophagus, it's also painful. It's like an ulcer, gastritis.
And if it's not maintained, it can progress into cancer.
It can lead into cancer in a small percentage.
But these diseases per se are not fatal or...
No, not fatal.
Or dangerous. Okay.
They can be debilitating.
Walang connection yun sa pangingitim ng kanyang skin. Bakit people are asking about that? And he's been defensive about it.
I'm not sure if he's defensive. He said...
Well, he jokes about it.
There are... we can only guess. There are certain medicines that can cause a darkening of the skin.
Also from medicine.
If you lack oxygen, if you have kidney problem, if you have liver problem, but I don't think he has those problems. Because if you have kidney problem, liver problem, of course you will have your dialysis shot. And you won't be able to be as vigorous.
So he's not showing symptoms of debilitation.
No, I think he can finish his term.
Reproductive health, what else can we be doing?
I agree with Senator Flavier and the health advocates. When I go around poor communities, when I do surveys, they want free pills and free contraception. It depends on their belief. So I think we should give it to them.
How is your relationship with I'm speaking of Dr. Flavier, how is your relationship with the Catholic Church?
I'm a Catholic, but I also go to a Christian church. I'm open with Muslims, so wala namang kaso eh. The problem is that some families, if you are a poor family, you have 5 kids or more, and you cannot feed them. If you are rich, you only have 2 to 3 kids. So we want to give the families enough education so they can have the correct number of kids.
Are we doing enough with AIDS, with the issue of AIDS?
Malaking problem yung HIV. AIDS, I think we are the highest or the one with the fastest growing rate. Mahirap yung HIV kasi. I think we should push for early testing and free testing for HIV. And free medicines should be supplied. For the prevention side, I'm not sure if mass media is the correct approach. Because if you do mass media, it's going to promote stigma. We should look at the high-risk groups and try to penetrate the high-risk groups, try to convince them one by one to get tested and for safer sex.
Sir, one more about health, something a bit closer to my heart. Tuberculosis. Is tuberculosis still a major issue in the Philippines?
Major
And-
issue.
And how big an issue is it? And is it being
Sobrang
discussed
laki.
enough?
Sobrang laki. Ang dami nating health problems. TB, we have, I think, 1 million patients with active TB. And the numbers are not decreasing. Actually, it's increasing. We're
These
in
are
that,
resistant strains.
yes, we have MDR-TB resistant, we have XDR-TB. And one TB patient can infect 10 other patients per year. So it's a big problem. We need to have these free medicines. And there's also stigma for TB. We have to tell the patients to get treated. In other countries, if you have TB and you don't want to get treated, they put you in jail.
Kasi I had TB before. I had 6 months treatment.
What can be done to reduce demand for prohibited drugs by to deal with drug abuse?
Drug abuse, okay.
To rehabilitate.
Yes. Sa war on drugs, there's a growing trend worldwide to treat it as a health issue
problem,
and
yes.
not as a criminal issue. We know what happened to Portugal when they decriminalized. Maganda yung results
So
nila.
by way of legislation,
Yes, in the
what can be done?
Philippines, we have maybe around 3 million drug users, and 98% are drug users. Only 2% are pushers who need to be jailed. But for the 98%, I think we should treat them. More rehab, we need more psychiatrists, psychologists, and doctors.
But we lack psychiatrists.
Yes, we lack psychiatrists and psychologists. And the relapse rate is very high, even if you go to a rehab center. So, magiging health issue siya. Okay naman yung plan A ni President Duterte, but the plan B is to slowly decriminalize like what they are doing in Canada. Meron silang 3-year plan. So, treat it as a health issue. Let's say, konti lang grams na huli. Just treat the patient instead of jailing him.
So you will be pushing for that kind of legislation.
I think
A
we
move
need to get
toward-
it into the conversation, and the Psychologists Association of the Philippines also already gave their stand.
Yeah, but are you happy or content or dismayed by how that conversation is being picked up or ignored by this government?
I think it's new to their thinking.
to decriminalize and to lower the penalties.
But people have been
Yes.
saying this for 3 years already, going on 3 years to this administration in particular. I remember even General Bato went to Colombia, attended a workshop, and he came back. I remember the sound bites acknowledging that we should look at this as a public health issue and so
Okay.
on. But I'm just wondering how you feel, as somebody who's been talking about this, how you feel about, I mean, do you still feel like you're talking in the wind? Do you feel like this administration is even open to that discussion on a very constructive level?
I think it's going to reach the Philippines. There are more and more countries, 10 to 20 countries na decriminalize.
Yeah.
So the conversation will go here because all the studies are going there. So
When you-
it will just take time. And let's look at the results of the president's campaign, if it's reducing the 3 million drug users or not.
When you go to the poor communities, do they express their concerns to you about this problem
For drugs?
for drug abuse? That it's a health problem, that, my son is
Yes.
an abuser because
Yes.
it's a health problem. Do they tell you that?
No, they don't tell us that. Kasi
Anong
illegal
problema
siya.
nila? Yung drug war talagang problema nila. When they talk about it,
From my
anyway,
experience, people feel safer now.
what do they come to you with problems about drug abuse as a health problem?
Yes,
They don't
also.
they don't realize that it's a health problem. They think it's a crime problem.
I think the families love their siblings.
Yeah.
They want them to get well. They
Yeah.
don't want them to get jailed. And there will be less interaction between the police and the drug user if you decriminalize. Because right now, di ba, may mga corruption issues doon. But if you're just, because for drug users, according to the studies, there's a physical problem dito sa prefrontal lobe. They cannot control it really. Most of them use shabu because they want to lose weight. They want to work as drivers.
Yes.
They want to work more and sleep less.
Yes,
So
but-
it's for earning.
And this is all, as you said, people have been saying this for the longest time. But not to belabor the question, but don't you feel that the conversation is going the wrong way when, against everything you're trying to say, Congress just voted to lower the age of criminal responsibility?
Regarding the age of criminal responsibility, syempre may pros and cons. If we look at the US and Singapore, the age of criminal responsibility is 7 years old. In Hong Kong, it's 10 years old. In Canada, it's 12. In South Korea, it's 14, but they want to reduce it to 13 kasi
Yes.
magiging masalbahe. So from 15, para sa akin, I think if you lower it to 13, baka okay because they are teenagers. Having said that, we need to increase the number of bahay pag-asa.
Exactly.
Kung wala naman bahay pag-asa, you don't jail them, you just release them.
Yeah, but precisely, is it fair to make that comparison? I know government has been making that comparison. Look at advanced countries, it's at 9, it's and so on. But look at the facilities of those countries. Look at the infrastructure and the support that those... isn't that a misleading comparison to be comparing us to countries that have all the resources to not only provide
Yes.
proper
Correct.
facilities,
I agree.
but
Totally.
psychiatrists, psychosocial support. And so we don't have any of that.
I agree. Parang 50-50 siya eh. We can maintain it at 15 or 30. I'm open-minded on this. I want to look at the studies where it is more beneficial. Sa tingin ko, hindi ko to ganong expertise eh. But I have an open mind on it.